Today we're going to be talking about how some of the things that you're doing to try and manage your anxiety might be actually making your anxiety worse. Hi everyone! Today we're going to be talking about something called safety behaviors in the anxiety disorders. And these safety behaviors are things that we do that make our anxiety worse, but which most people don't know about and most people don't understand. But before we get into that, just a couple of disclaimers to go over. I'm a registered psychologist in the province of British Columbia, Canada, and this video is for informational purposes only. It is not intended as a substitute or replacement for advice from your doctor or mental health professional. Now, with those things out of the way, let's start talking about safety behaviors in the anxiety disorders. Now, I talked in a previous video about how avoidance maintains anxiety and the importance of exposure as a way of overcoming anxiety. And once you understand it, exposure actually makes a lot of sense, and it's something that a lot of people know about, as we commonly refer to it as, facing your fears. However, there's another major factor that tends to drive and maintain anxiety, and that's something called safety behaviors. And one way of thinking about safety behaviors is that they're more subtle forms of avoidance that people will engage in to try and reduce their anxiety. Safety behaviors are anything that a person does in order to make themselves, or in order to help make themselves feel safer, but that don't have any substantial impact on actually making them any safer. They don't have any substantial impact on actually making the person any safer. And you'll find safety behaviors in all of the anxiety disorders. And sometimes they can be subtle and not necessarily obviously related to the anxiety itself. So let's talk about some of the different anxiety disorders and examples of safety behaviors that you might find for each of these anxiety disorders. And so let's start with specific phobias. Suppose I had a fear of motor vehicle travel. One of the safety behaviors I might do is to leave more space between me and the car in front of me, because it feels safer to have 8 car lengths buffer just in case I need to stop quickly. Another example is that if I'm a passenger in a vehicle, I'll grab onto the door handle or step on the imaginary brake pedal when the driver's driving. So think about it. Does leaving that much space between cars, or grabbing onto some part of the vehicle, or stepping on imaginary brake pedal, do those things actually make me any safer? Well, they don't, but I do these things because they make me feel safer. But they're not actually making me any safer. So let's talk about panic disorder. So with panic disorder, I may stop drinking coffee because I know that coffee gets my heart rate going. And if my heart rate gets going too quickly, I'll have a really bad panic attack. And I worry that might trigger a heart attack. Another thing I might do is to make sure that I'm never too far away from my cell phone, just in case I start to feel a panic attack coming on and I need to call for help. Sometimes people will carry a little bottle of Ativan with them, even if they have no intention of using it or haven't used it in months. Now think about these behaviors. What's the likelihood that drinking coffee would actually trigger a heart attack? It's probably very low, and so avoiding drinking coffee isn't actually making me any safer. Even if I started having a panic attack and I called for help on my cell phone, what would that actually do? By the time anyone got to me, chances are the panic attack may have already passed. So what if I have Ativan with me? Sure, it may stop a panic attack if a panic attack comes on, but is the panic attack actually dangerous? You see, avoiding drinking coffee or having my phone with me all the time or carrying around Ativan, these things don't actually keep me safe. And social anxiety. Safety behaviors include things like avoiding wearing clothes that are too flashy, or wearing clothes that blend in so that nobody notices me. I might avoid making eye contact with people. I might bury my head in my cell phone when I'm at the bus stop so I don't have to interact with others. By doing these things, I'm less likely to have social interactions, and if I have fewer social interactions, people are less likely to judge me negatively, or I'm less likely to do something to embarrass myself. But does wearing bland clothes, or avoiding eye contact, or avoiding interactions, does doing these things actually prevent bad outcomes from happening? Well, the social anxiety would tell me yes, but is that actually the case? Would bad things actually happen? Well, the thing is, we don't know, because these safety behaviors prevent us from testing our negative assumptions of what would happen in these social situations. Moving on to generalized anxiety disorder, when I have excessive worry about a range of topics. If I'm worried that someone will get really upset with me if I disagree with them, the safety behavior may be something like being especially agreeable and not sharing my actual opinion with them, trying to get along with everyone so that no one gets upset with me. If I'm worried that my assistant isn't going to send off that report for me in time, I'll do it myself to make sure that it's done right, and I won't delegate that task. If I'm concerned about an important email that I'm sending, I might review it over and over again, or ask someone else to review it for me to make sure that I'm coming across clearly. Is being very agreeable with people, or not delegating tasks, or engaging in reassurance-seeking behaviors, is doing any of these things actually keeping me safe or preventing bad things from happening? Is it doing anything to prevent these worry outcomes from happening? Well, probably not. What about obsessive compulsive disorder? Now, one way of thinking about the compulsions in OCD is that the compulsions in and of themselves are safety behaviors. So if I touch a doorknob and I have the obsessive thought that my hand is contaminated, I'll go and wash my hands multiple times, and that'll help me feel better because my hand is now no longer contaminated. I'm safe, unlikely to poison myself or anyone else. If I get the intrusive thought that I hit someone with my car when driving home last night, I might check the newspapers to see if there were any stories of hit-and-run accidents, or I might call the police station or hospitals to see if anyone was brought in with a hit-and-run in my area. Do these types of behaviors prevent any negative outcomes from actually happening? Well, probably not. It's extremely unlikely that touching the doorknob was actually going to make me or anyone else terribly sick. So washing my hands repeatedly probably didn't do anything to prevent a negative outcome. It's incredibly unlikely that I would have hit someone with my car and not know that I did it. So does trying to find out if something like that actually happened improve anything? Let's talk about post-traumatic stress disorder. And one way of thinking about safety behaviors in PTSD is that the hypervigilance symptoms of PTSD are good examples of safety behaviors. So if I go into a restaurant and I always sit with my back to the wall, and I do that because it allows me to keep an eye out on all of the entrances and exits of the restaurant. So I know who's coming in, in order to see if there's anyone dangerous or anyone who looks threatening entering the restaurant. Now, sure, by always scanning the restaurant, I may be able to identify people who are dangerous or threatening earlier on, but how often is that actually likely to occur? How dangerous or threatening are people? How often are there random acts of violence in restaurants? Now, what about health anxiety? Something that's also called illness anxiety disorder. Safety behavior might be something like researching information about a rare and unusual medical condition that I'm concerned about in order to learn about the prognosis, the symptoms, the treatment of that rare medical condition. So the research may be informing me about this rare type of medical condition, but how likely is it that I actually have this exceedingly rare condition? Well, if it's exceedingly rare, then chances are I'm highly unlikely to have it. But I make numerous appointments with my doctor to get investigation after investigation into some stomach pains I've been having. Even if my doctors reassured me that it's just gas, I want further tests done just to make sure nothing was missed. Do those multiple further tests actually do anything to make me safe? Probably not. So the take-home point of all of this is that not everything that makes us feel safe in the moment is actually making us safe. In fact, the way we behave, in a subtle way, tells us how dangerous or threatening a particular situation is. If we're behaving like something bad is going to happen, or that catastrophe is imminent, of course we're going to feel scared and anxious. And that's what these safety behaviors are doing. We're behaving like something bad is just about to happen. So when it comes to reducing anxiety, it's not just about exposure to feared situations. That's part of treatment, but it's also important to work on reducing these types of safety behaviors. And if you're interested in learning more about safety behaviors and how safety behaviors work, I've posted a video with more detail about that, so I'd encourage you to take a look at that video as well. So I hope that gives you a better sense of some of the various types of safety behaviors that occur in different types of anxiety disorders. I would love to hear your thoughts or questions about this, so please leave me some comments in the comments section down below. If you've been enjoying my videos and would like to see more, please hit that subscribe button and notification bell, and you'll be alerted every week when I post a new video. So that's all for this week's video. As always, thank you for making it all the way to the end of this video, and I will see you in the next one.